Hello everyone, I am Mansi Mukul, currently pursuing my BDS at Bharati Vidyapeeth. I am a third year student. Today my topic is Physiology of Saliva and its clinical effects. Saliva is most valuable oral fluid that is often taken for granted. It is critical for the preservation and maintenance of oral health, yet it receives little attention until quality or quantity is diminished. Saliva is largely an unheralded, unsung, and ignored secretion. Saliva is a clear and slightly alkaline mucoserous exocrine secretion, and it consists of secretion from the major as well as minor salivary glands. Major talking about the parotid, sublingual, and submandibular glands, and minor salivary glands like palatine glands, lingual glands, etc. Salivary glands have secretions such as serous, mucus, and mix that contains both serous and mucus secretion. The nervous regulation of salivary secretion is controlled by autonomic nervous system, controlled by two different types of nerves, sympathetic and parasympathetic. Saliva consists of 99.5% of water and also contain many substances including electrolytes, mucus such as polysaccharides, glycoproteins, antimicrobial compounds such as secretory immunoglobulin A, hydrogen peroxide, and various enzymes like alpha amylase that starts digestion of starch, lingual lipase, callicarin. It is an enzyme that proteolytically cleaves high molecular weight kininogen to produce bradykinin, which is a potent vasodilator. Some other compounds are found in saliva, such as opioorphin, which is a pain-killing substance. Heptocorrin, it is a protein which binds to vitamin B12 to protect it against degradation in stomach before it binds to intrinsic factors. There can be various factors affecting the flow of saliva, like individual hydration. Secondly, can be the diurnal variation, as the concentration of total proteins attains its peak at the end of the afternoon. Various habits and body postures also affect the salivary flow. Habits talking about like smoking. Men that smokes present significantly higher stimulated salivary flow than non-smoking men. Olfactory stimulation and smoking a temporary increase in unstimulated salivary flow. Many cases of drugs, particularly those have anticholinergic actions and antihypertensives, also affect the salivary flow. The action of chewing something tasteless itself stimulates salivation, but to a lesser degree than the tasty stimulation caused by citric acid. Saliva has multifunctions like digestion. The moistening and lubricating action of saliva allows the formation and swallowing of the food bolus. It has protective function also. The salivary mucins, which are present, form a barrier against noxious stimuli, microbial toxins, and minor trauma. It also plays antimicrobial action, and it has buffering capacity, which protects the teeth from demineralization and subsequent dental caries. Maintenance of tooth integrity also comes as a part of salivary function. The tissue repair, a variety of growth factors and biologically active peptides present in the saliva which aid in tissue repair. The most important function is the taste. Unless food is mixed with saliva, you can't taste it. The saliva produced by the minor salivary glands as well as major salivary glands has the proteins that are bind to the taste substances and present them to the taste receptor. The clinical consideration of saliva can be of two types. Either it can be hypersalivation or the hypersalivation. Hypersalivation, that is reduction in secretion of saliva, it can be either temporary due to some emotional situations like fear, anxiety, fever, dehydration, or permanent like aplegia, Bell's palsy, which is paralysis of facial nerve, sialolithiasis, obstruction of salivary duct. Now, the dryness of mouth, a loss of salivary function or a reduction in the volume of secreted saliva may lead to sensation of oral dryness. It can be caused by certain diseases like Sjogren's syndrome, diabetes, alcoholism, radiation therapy of head and neck. The second comes is the hypersalivation. Excess secretion of saliva, uh, like conditions such as neoplasm of the mouth, neurological disorders, Parkinsonism, they all can lead to hypersalivation. One condition is sialorrhea, excessive salivation often experienced by the individual and experienced by the individual and noticed by the operator. This can be caused by teething, oral cancer, patient with neurological disorder also sometimes. From the prosthodontist point of view, salivary glands are of great importance, both anatomically and physiologically. Saliva is considered as a major factor in evaluating tension. Saliva plays a major role of caries. Molecules of saliva, which increase the pH of biofilms, and hydrolysis of these compounds produces ammonia, which increases the pH of biofilm. So saliva helps in remineralization of the teeth. The components of saliva can act as mirror of the body's health. So analysis of saliva is useful in certain conditions like in diagnosis of hereditary disorders, autoimmune diseases, malignancy, and as well as in the assessment of therapeutic drugs and monitoring of illicit drug use. Saliva contains certain substances which can act as biomarkers like proline-rich proteins, agglutinins, and it is also a biological factor. Like saliva has been shown to be the most important biological factor in prevention of dental erosion. As there is an old axiom which states you never miss the water until the well runs dry. How true this is in especially for saliva. The fact is a world without saliva is a world without pleasure, like living with a drought. With the no saliva consequences, there can be certain symptoms like rampant dental caries, erosion of enamel, or tissue damage. So, saliva plays a very important role in the maintenance of oral hygiene. A very interesting fact about saliva is a person will create enough saliva to fill 2 average size swimming pools during his lifetime. See the massive amount of secretion of saliva. Thus, its importance can't be neglected at all. The components of saliva has multifactorial role that continue to represent the focused area of dental research. The component of normal salivary composition, flow and function is extremely important on a daily basis when treating patients. So I will conclude it as dental health professionals spend untold hours removing this precious natural resource to perform therapy with little regard to its value until flow is significantly reduced. Whether saliva in quantities large or small, recognition should be given to the many countries' oral and systemic health. Lastly, I would like to talk about a human habit that is spitting. Spitting is the act of forcibly ejecting saliva or other substances from the mouth. In many parts of the world, it is considered rude and a social taboo and has even been outlawed in many countries because saliva can contain large amount of virus copies in infected individuals. For example, in people infected with SARS-CoV-2, spitting in public health can pose a health hazard to the public. At last, I would like to quote a statement by Mandel, which was given in 1990. Saliva lacks the drama of blood, sincerity of sweet, and emotional appeal of tears, and intimacy of GCF. Hence, I would like to conclude my topic and thanks a lot.